So as aides, we're also responsible for opening and closing procedures as well as some cleaning. Again, though, patients are your main priority, so make sure you take care of them first before you're doing these items. So first right here is our list of closing procedures. So at the end of the day, you're going to start doing these so we can get ready to close. When you do an item, you're going to initial next to the item and the day. If you initial, that means you are held responsible for doing that, so make sure that if you initial, you actually did that. So these items are for every single day we do these, and here it depends on the day when we do these. Wiping the machines, that includes all of the machines right here, the bike, the Genubender, the isolexer, Total Gym, multi-hip, the bench right there. Also make sure that you don't forget about the UBE, the arm machine that's back over there. We need to wipe that down as well. Spiffing the rooms right here. That means cleaning the rooms. You're going to take out the trash, change the pillowcase, wipe the table down, make sure it's neat and tidy. Vacuuming, which you do on Tuesday, Thursday. You can find the vacuum over in this cupboard right here, as well as the broom. The mop is in the laundry room. Some sprays, table treatment, and our general cleaning spray are right over here, and we use a raggedy towel for that, which you can find right in here on the top. And the Windex and some other cleaning items are up in that cupboard right above the fridge. On the back side of this sheet, we have the opening procedures. So this is what you're going to do when you come in for a morning shift for the day. The most important thing to do for this list is to look at the patient list for the day and to pull the charts for the entire day. So you're going to come in here, and as you're looking at the patient list, which is printed, it's also on WebPT, you're going to pull the charts. So for instance, if John Doe was coming in today, I would put his chart up like this. It's alphabetized by first name. So you want to get morning and afternoon patients that are coming in, so that's ready. It is a list of items you can do if you have some downtime, all the patients are taken care of at that moment, or maybe there aren't any patients in the clinic. You can do these cleaning items. We also have some periodic maintenance items. So we have weekly, monthly, and quarterly, or as needed. When you do these items, you're going to initial that you did it and then write the date that you did it so we know when it was last cleaned.
After each patient has been treated and has left the clinic, you need to clean all of the equipment that they have used and also their table and room. So not only are you doing opening and closing procedures, but after each thing is used, you also need to make sure to follow up with cleaning those tasks or those items that they